So, my name is Yakuma Crystal. I'm a pediatric endocrinologist and biomedical informaticist at Vanderbilt University Medical Center. And today I'll be talking about voice recognition and data entry. I just want to disclose that our research team works with Nuance Communications and uses their natural language processing libraries for some of our own research and development. So we'll start with a reflection. Has this ever happened to you?
Alexa, play the song Splish Splash, I Was Taking a Bath.
I can't find the song Splish Splash, I Was Taking a Crap.
And I'd like to start by saying that I got permission from the council to use that clip. So what are we talking about today? Speech recognition, but specifically in the context of dictation. We can talk about our issue with Alexa at a different time. So to make sure we're on the same page, definition. So speech recognition, transcription of the spoken word. There are actually two kinds of speech recognition. You have your front-end speech recognition, where you have real-time speech recognition software that captures and processes the word. And then you have your back-end, where you have a recording that's captured and a transcriptionist that forms the final document. For the purpose of this conversation, we're going to be talking about automatic speech recognition. So why speak? Well, it's simply to say the answer is just, it's faster. So writing takes about 13 words per minute. With typing, you can capture about 40 words per minute. And speech is 150 words per minute, easily 3 times faster than typing as a modality to capture information. So with the 10 minutes I have allotted, I can spit out about 1,500 words at you if I go reasonable pace. So I think a better question then would be, why not speak? What are the limitations that prevent speech recognition and dictation from being the optimal modality to solve all our problems? Well, imagine this. You're in a clinic getting ready to see your next patient. So you're reviewing your last set of notes to get you up to speed about who the patient is. And you see that you wrote the patient has a history of sick as hell disease. And you're a little mortified because you're thinking, why in the world would I write something like that? And then you remember that day you were using dictation and there might have been an error because what you meant to say was the patient had a history of sickle cell disease. And you feel bemused and you say, well, the referring provider is going to get a laugh out of that one. Hopefully they understand the nuances of dictation. But then you realize that on April 4th, it's not just the referring provider reading your notes, it's the patient as well. And they might actually lose confidence, your competence to communicate if you're having things like sick as hell disease appear in the note. So it's more than just the words getting spoken wrong and Alexa making you laugh, but there might actually be consequences to having your words misunderstood. But why would we find ourselves here? Especially when in 2016, Microsoft proudly announced that they beat the human error rate of 5.1% and that natural language processing was now on parity with human understanding. This was based off a data set called Switchboard and Call Home, where you have a cohort of recorded conversations between humans talking about day-by-day topics like buying a car or going to a ball game. And we have human transcriptionists that have transcribed those thousands and thousands of recordings. And then Microsoft had an algorithm that beat what the base transcription error rate was. But still, we have these errors that just don't make sense to us. And that's the important thing I want you to pick up, make sense. So it's all about context. And if you can remember back to 4th grade, the concept of homophones. These are actual examples I'm going to give from my clinical practice because I have a running list, unfortunately, of embarrassing errors that I picked up after the fact. So sometimes when I see a patient with low blood sugar, we have to do something called a fasting study to figure out why their blood sugar is running low. Well, I was going back to read a note and I saw that I wrote that patient had to have a vaccine study. Thinking about context, if one of my colleagues in pediatric endocrinology was reading that note, they would probably extrapolate that what I meant to say was fasting study. But if a urologist or an orthopedic doctor read the note, that would just not make sense to them at all. But what about when I wrote the patient had hyperglycemia and it got transcribed to hypercalcemia? So this word is actually a very probable thing for me to say in any kind of endocrine note. So this doesn't just come down to context, because within the context that makes sense, but it comes down to my actual intent of what I was trying to communicate. And in that case, the concerning thing is only I would actually know that. And finally, what about when your words get misunderstood altogether? If I write something like, there's inadequate data here to proceed with the diagnosis, and it gets transcribed to there's inadequate information here to proceed with the diagnosis. Now that actually changes the entire meaning of my note. And when someone reads that, errors can occur. And it's not just me, guys. I wasn't surprised to see in a JAMA article in 2018 where they're looking at speech recognition errors. One of the examples they actually found was when another provider had written inadequate evaluation to exclude neoplasia, and it was transcribed to say an adequate evaluation to exclude neoplasia. So in this article, they reviewed about 217 clinical notes from 2 separate institutions, and the average error rate was 7.4%. Think about it. Think about having to go back to correct 7.4% of the content you created. About 20% of those errors pertain to clinical information, and the rest were things like grammar errors and word mistakes. The common errors you saw were deleting words and inserting words that could change the meaning of the things you saw. And what's the interesting part is revision rate after someone went back to actually figure out what the context was, what the intent of the communication was, the error rate dropped to 0.4%. So if you take the time to go back to clean up your note, then it's fine. But if you're taking time to go back to clean up your note, what time are you saving? And there was negligible variance between physicians of different genders and specialties. So this comes back to the question, is it worth it? If you do the back of the napkin calculation, thinking about the utility, enjoyment, and cost, and do the calculus in your head, you're saying, well, it saves me time. I can get down a bunch of information, but what is it costing me to have to do it? So thinking through the technology acceptance model and the variables that go into people deciding about whether they want to use a particular tool or not, in the specific case of speech recognition, you think about things like the external variables, the perceived usefulness, perceived ease of use, and the attitudes about it. And I've distilled down just the relevant considerations for the cost of dictating, the cost of talking. What is it worth to open your mouth to write your note? So we all agree it's faster, but how much better is it if it's actually not even there? So speech recognition, do you have an enterprise agreement in your institution? Is it there for you where you can something like Nuance's Dragon where it recognizes medical words, or do you not even have an enterprise agreement? So you have to use Siri, which might understand medical words as well. Social norms. So maybe you work in the ED where everybody's dictating and it's just part of the culture of what you do. Or maybe you work in a clinical setting where not a lot of people dictate and you're that one weird person that's really loud in the corner screaming at your machine all the time. And it makes it more awkward to want to adopt this workflow. What about background noise? So yes, you work in the ED and it's a social norm to have dictation, but if it's really loud all the time because everybody's yelling, maybe it's not the best environment to be dictating at all. What about things like privacy? Are you in a setting where you can capture information and confidently write a note about your patient's sexually transmitted diseases? Or maybe the voice input isn't the best mechanism to use at that time. What about your cognitive comfort? Where are you in terms of your training and your understanding of how to compose a narrative with words, where you can simply talk into a microphone and dictate your notes versus having to pause and think about how to construct a sentence? Physical comfort. Do you have a bad cold? Do you have the COVID and your throat really hurts and it actually causes you physical pain to talk? That's a consideration when you're thinking about how am I going to enter in my note that day? Convenience. How easy is it for you to switch input devices, to go to the screen, to find the thing you need, to find the button you need to click? Tools. Can you carry around a power mic to every machine you have to go to? Can you use the power mic on your phone? Does your institution require you to have mobile device management to use power mic, but not mobile device management because you don't want your institution falling around everywhere? These are just the considerations people have to take into account to decide, is it worth it for me to open my mouth? Speech. Maybe you're not from around these parts and the computer doesn't always understand the words you say. And worst of all, errors. If it takes you just as long to go back and fix everything you put down, maybe that outweighs the funness and the speed of it all. So in summary, voice is a quick and intuitive way to capture information. There are very important environmental and technical limitations that can impact how effective this modality is. The weight of each of these variables is going to vary per individual. So all those little things like the loudness of the environment, how easy it is to access, depending on who you are, those numbers are going to be different. But what's funny is the weight of each of these variables vary in the same person, situation per situation. So today I feel like dictating, but tomorrow I'm going to have a sore throat and it's not going to be the best situation. And then context matters. So yes, speech recognition is on parity with human recognition, which means the computers can hear what we are saying, but can they understand what we are saying? And that's the gap that we need to reconcile in order for this to be a modality that we can all really benefit from. Thank you.